What is comprehensive breast cancer care? Often when people hear breast cancer rehab, they think of lymphedema treatment, and that's because lymphedema is the #1 feared side effect for breast cancer patients. But it doesn't mean it's the most common or disruptive. I've had so many people come to me during and after cancer treatment with life-altering and often chronic conditions that have severely impacted their quality of life. Now, imagine being a kayaker and you're not able to get back to the sport that has brought you so much joy because you have shoulder dysfunction. No doctor or physical therapist has been able to accurately diagnose your problem, so you begin to feel like a lost cause. Imagine having persistent pain in your breast after lumpectomy. The pain goes well past the healing timeline, and your doctors think, well, we didn't really remove that much tissue. So they prescribe pain medication. But when it doesn't resolve, you begin to get the idea that they think that you're crazy. Imagine being fearful that you could lose your relationship because you haven't been able to have comfortable intercourse for years, and the desire is just going away. Or stopping hormone therapy, the drug that you were told would prevent your cancer from reoccurring because you just couldn't tolerate the joint pain anymore. Imagine limiting your activity due to fatigue, peripheral neuropathy, cancer-related osteoporosis, or fear of lymphedema when exercise is the #1 thing you can do to make these problems better, but you have to know how to do it effectively. You may feel right now like I've really killed your good vibes, but don't worry, I'm not gonna leave you here. I just want you to imagine how hopeless some people who have had breast cancer feel. We talk about the fight against cancer so often, and that's a term that can really upregulate the central nervous system. If you apply brain pain neuroscience to your practice or study the benefits of mindfulness and meditation for healing cancer, you know why I question the benefit of this language. But I digress. Imagine feeling like you went into battle with cancer and you weren't given all of your swords. That's what learning about the benefits of rehabilitation late in the game can feel like to a breast cancer patient. Yes, rehab services can come with utter relief and gratitude that someone has finally put their finger on the problem and can help. But often it comes after much unnecessary strife. Helping breast cancer patients and the system that provides care evolve is one of my biggest missions in life. It was through my training as a lymphedema therapist that I began to treat more cancer patients. Because my mother was diagnosed with breast cancer when I was 12, I saw the long-term side effects of breast cancer treatment. I, for example, remember what it felt like to hug my mom and have her recoil because of a brachial plexus injury from surgery. I saw the lasting fatigue. I knew to delve deeper with my patients. There weren't really any mentors around me who could give me the answers I needed to help these patients, so I turned to the research, which at the time was scarce. I remember celebrating 5 years remission with my mom, but I know what end-stage cancer looks like too. When I was in school for physical therapy, my best friend had a mole removed from her back. She called me and told me she had swollen lymph nodes in her neck. It was on the same side as the surgery. So I told her that her lymph nodes were probably just going into overdrive to clean up the site of surgery. She called me a couple of days later and told me there were more. I knew in my gut at that time it could be cancer. And the following Friday, it was confirmed. I remember helping her with her constipation during chemo with acupressure points. I remember teaching her scar tissue mobilization after extensive abdominal surgery. I remember being in the hospital and requesting physical therapy when she was in the bed for days, walking with her and teaching her family exercises to do with her. Now, a lot of this sounds depressing, but honestly, Courtney achieved a level of spiritual knowing and appreciation for her life after her cancer diagnosis that brought her towards her own self-actualization. And I know that she is helping me in this mission from the other side. Some people have told me that they aren't sure that they could work with cancer patients because it seems like it would be depressing. Now, I totally respect that. And I have had the opportunity to teach and work with rehab colleagues from around the world. And many of us have agreed over a glass of wine that it is the most rewarding work we have ever done. These patient scenarios I spoke about at the beginning of this episode, I actually treated. My patient who had shoulder dysfunction got back to kayaking within a month. My patient's pain after lumpectomy resolved without medication. My patient who was not able to be intimate with her partner after 10 years and just stopped trying got back to pleasurable sex and intimacy without the use of topical estrogen. I have so many patients with success stories like these, and I'm not trying to paint rehab as a cure-all, but we are in the position to not only treat these side effects, but prevent them as well. Comprehensive breast cancer care is about knowing how to prevent and treat all of the side effects of breast cancer. If patients have post-op issues such as seromas, lymphatic cording, shoulder dysfunction, or core compromise, they need access to rehab providers who can help. And sadly, there just are not enough of us. If you're an orthopedic therapist, these patients need your eyes and your hands. But please know, you may not be able to apply all of your manual therapy techniques and all of your modalities in the same way with cancer patients safely. So know what you're doing. So many people are living with chronic pain after treatment, like post-mastectomy pain syndrome, chemotherapy-induced peripheral neuropathy, joint pain, and dyspareunia. Often these are seen as unfortunate side effects from life-saving interventions, but it doesn't mean that they are not preventable and treatable. I'm calling on the pelvic health practitioners, the neurospecialists, the researchers to apply your expertise to these underserved areas. And we also need to take into consideration that survivorship is improving and that we as rehab providers need to be aware of the long-term side effects so we do not do any harm. If you don't think that you currently treat breast cancer patients, I would bet you that you do, because 1 in 8 women will be diagnosed with cancer in their lifetime. Breast cancer survivors are living longer, and they want to put cancer behind them only to discover years or even decades later that they have latent side effects of treatment. We are working with these patients, whether we know it or not, and we need to respect that we have the potential to do harm if we don't know what we're doing. Or if we even understand the basics, we can help the medical team promote prevention and give them early intervention, which we know is not only beneficial to the patient, but the healthcare system as well. Let me give you a couple of scenarios about do no harm. Did you know that women are more likely to die of cardiovascular events than cancer? And that the cardiovascular mortality rate of cancer survivors is 7 times greater than the general population? We could easily be working with an orthopedic patient and not think to take their vitals. But if they were a breast cancer patient and you knew which interventions predispose someone to long-term cardiac compromise, you might think to take baseline vitals, get them during activity and after exercise. What if you identified a latent arrhythmia or that blood pressure that just was dropping after exercise? That undiagnosed cardiac dysfunction that may never have been identified until it was too late can now be monitored and treated because of you. Here's another scenario. Did you know that people who had breast cancer have a 68% times greater risk of getting osteoporosis and osteopenia compared to cancer-free women, and that 77.8% of breast cancer survivors who have osteoporosis are not diagnosed? I did a telehealth consultation yesterday with a woman on the phone who looked 35. She reached out to me because she was having pain in her thorax that she thought was related to her implant. I would never guess that she had osteoporosis if I hadn't asked about her bone health. I could have prescribed her an exercise or performed a mobilization if it weren't telehealth that is contraindicated for that person who has osteoporosis. This could also be the driver, though, of the pain in her thorax. Me knowing this, I can make sure she gets the differential diagnosis she needs and do no harm. What if she didn't know she had osteoporosis, but I knew her risk based on what treatment she had? I could then ask her to get a DEXA, and if she had bone thinning, teach her how to recover that bone with exercise and help her retain her quality of life for years to come. These are actual scenarios as well. I'm not trying to toot my own horn here. I know I've missed the boat more times than I even care to know about, or I do care to know about, but I don't know. But this is what it means to be in a doctoring profession. Our knowledge and skills put us in a unique position to teach and treat cancer patients. Cardiologists don't think about bone health much. Oncologists don't usually ask about sexual health. Some surgeons don't even know the side effects of their own procedures, and respect to them. But they don't know how to treat them or who to refer them to most of the time. It's not their fault. They're doing what they know. But we have a unique perspective on systems integration. Few professions out there know anatomy like we do. Few professions out there understand the biopsychosocial model like we do. Imagine the ability of cancer patients to get early intervention at the time of diagnosis. Imagine having skilled providers from acute care to outpatient to home health. Imagine improved continuity of care across these areas with rehab practitioners being at the table as part of the cancer team. Our profession in the US started with treating polio patients, then veterans wounded during World War I. We have just evolved. We became the generals, then the specialists, then the doctoring profession. We continue to fill in the gaps of healthcare, getting people back to optimal function and restoring quality of life. Oncology is one of these areas where we need growth now, and we do have the momentum to do it, or we're getting there. I like to give an action item every week. If you're a rehab practitioner treating cancer patients, I'd like you to come to the Pelvic Health and Breast Cancer Rehab Specialists Facebook group and tell us what your experience has been like serving this population. And if you ever have any questions about working with breast cancer patients or don't have the training but need some help, post in the Pelvic Health and Breast Cancer Rehab Specialists Facebook group. We are here to help you. If you're inspired, please consider taking my course, Breast Cancer Rehabilitation, Comprehensive Evaluation and Treatment. I offer this course online in a self-paced and interactive format. You can learn more about this course and register at yourcoreacademy.com. Practitioners who successfully complete the course become a certified KickPink practitioner and will be listed on kickpink.com. KickPink is an online educational website for breast cancer patients or people who have had breast cancer, and it's coming this year in 2021. If you're not ready to take a course, at least pick up my free safe exercise screening tool for breast cancer patients. The intake form provided doubles as a screening tool, and I walk you through like a 29-page analysis to help you identify risks with exercise based on treatment regimen. I provide charts that will tell you which chemotherapy, hormone therapy, and targeted therapies will put your patients at risk for weight gain, lymphedema, pain, cardiotoxicity, peripheral neuropathy, osteopenia, and it's free. There's even a lab values chart in there. So finally, as we discussed, do no harm is a basic tenet of medicine. Even if you can't commit to a course yet, I think every practitioner should have the Do No Harm guide for breast cancer patients. It will tell you what modalities, exercises, manual therapies, and more are contraindicated or where you should take precautions after specific cancer treatments. You can get this in the practitioner section under handouts at yourcorept.com.